It's a conversation with the team. It's a little bit of a culture shift. Should we be utilizing sedation more? And talk to the people that are doing these procedures, but don't be scared to try it, make a change, and I think you will see the benefit really, really quickly.
Hey everybody, welcome back. Thank you so much for joining me for this episode, sponsored by DECRA. We're going to talk about procedural sedation. We really do our best to set our patients up for low-stress visits. We use pre-visit pharmaceuticals, gentle handling, all the tricks, but sometimes we still need sedation. Maybe it's a dog who is just not having it despite their PVPs, or a patient who needs quick x-rays but doesn't respond well to any sort of restraint, or a pet who needs a minor procedure like a laceration repair or a small mass removal. These are the moments where injecting, haha, pun intended, procedural sedation into our workflow can really create a smoother and less stressful day. Following an early morning VMX breakfast session, Dr. Jane Quant, Dr. Tanasia Crocker, and VTS in anesthesia and analgesia, Darcy Palmer, joined me in the podcast studio to talk about procedural sedation and where sedatives like Zen Alpha fit into our sedation toolbox. If you're interested in how to incorporate procedural sedation into your workflow, or you have questions about how to use Zen Alpha, stick around for this one. Let me tell you about our guest. We'll go ahead and get into it. Dr. Jane Quant is a board-certified anesthesiologist and criticalist and a tenured professor at the University of Georgia. She earned her DVM from Iowa State and a master's degree in anesthesia from the University of Minnesota, and is a diplomate of both the American College of Veterinary Anesthesia and Analgesia and the American College of Veterinary Emergency and Critical Care. With over a decade at the University of Minnesota before joining UGA, Dr. Quant has trained countless students, authored 26 textbook chapters, and published extensively in peer-reviewed journals. She's also a highly sought-after speaker and a beloved educator, frequently recognized for her outstanding teaching and clinical work. Dr. Tanasia Crocker is a 2009 graduate from the Texas A&M University College of Veterinary Medicine, with a passion for mentorship and empowering the next generation of veterinarians to find success and joy in the profession. Her career includes experience in equine ambulatory practice, small animal general practice, and emergency medicine, as well as practice ownership, giving her a well-rounded perspective on the profession. Outside of veterinary medicine, she stays busy in Texas with her spirited 9-year-old daughter, funny 5-year-old son, and supportive husband of 15 years. Darcy Palmer is a credentialed veterinary technician with 24 years of experience, including 18 years as a veterinary technician specialist in anesthesia and analgesia. She currently teaches both didactic and clinical anesthesia at Tuskegee University College of Veterinary Medicine, helping train the next generation of veterinarians. Beyond the classroom, she's deeply involved in the profession as the executive secretary for the Academy of Veterinary Technicians in Anesthesia and Analgesia, and an administrator for the popular Veterinary Anesthesia Nerds Facebook group, where she helps foster education and discussion among anesthesia enthusiasts. All right, this was such a great discussion. Let's go ahead and get into it.
Microbiome science is a swiftly evolving field that has caught the attention of pet owners. Are you prepared to answer their questions? NAVC's brand new veterinary microbiome certification course will give you the skills to implement microbiome science in your daily practice and improve patient care. New research shows maintaining a balanced gut microbiome is vital for optimal nutrition, disease prevention, and longevity in pets. Register today on VetFolio.com.
All right. Well, I'm excited. I am joined by Dr. Tanasia Crocker, Darcy Palmer, and Dr. Jane Quant. We're going to talk about procedural sedation. Thank you all so much for joining me. I feel like this is such an important topic.
Yes, thank you for having us.
It is important. We've had so many questions about it, and I feel like every time we talk about it, we get the same questions over and over. So it's exciting to do a podcast, or maybe we can get the info out there and just reach more people about it, because we feel like procedural sedation is important for everyone to know about.
Absolutely. You know, we're talking about like low stress handling and things like that. There's just, you know, with all the options we have, it just seems like in so many situations, there's there's no reason to like perpetuate the wrestling, the tackling, the, like, okay, we're going to get this, whatever it may be, real quick, when we do have a lot of safe and effective options.
Well, I think not only from a safety point of view, but also from fear-free, right? We should try to make sure that the animal is not stressed. If the animal's not stressed, it decreases the stress on the human. And for radiographs, for example, that to me is where procedural sedation has a keen interest, is for me at a university, OSHA says we shouldn't have people holding animals in the room so they're not exposed to radiation. Well, that's where procedural sedation really needs to be, not only for the dog, but to protect the humans from some things like radiation exposure.
Yeah, and from a support staff standpoint, we all know that the veterinary technician career field's kind of in crisis mode anyway and trying to do retention. But when you have a practice that is requiring their staff to manhandle or wrestle these dogs to try to do a procedure or get radiographs or something like that, it just, it wears on you. And so a lot of, compassion fatigue or just fatigue in general from being in the practice, it gets to you having to deal with animals in that manner all day long.
Well, in a GP setting, I think that it is harder to do something that, one, is going to cost the pet owners more and is going to take more time in the long run sometimes, not if you do it right, but we can get into that a little bit more. But I do think that it is a mind shift and a culture decision as a practice to say there are better ways to do this and we need to be trying it, we need to be implementing it. And when you see the value of it and you explain it to the owners that it's going to be less stressful, we're going to get better x-rays, or their pets, going to be not as fearful of the nail trims because you're using it in the right way, you get buy-in a lot faster than you think. So we're slow to change things in our industry sometimes, or to consider that it could be done differently. And I think Zen Alpha has kind of pushed us to think a little bit more about some of these processes we've done for a long time, especially in GP. And after I made the changes, I saw really quick buy-in from my team and from pet owners, and I didn't get the pushback that I was worried about initially.
Yeah, I couldn't agree more because, Darcy, to your point, when a pet owner walks in, when we're talking about, and Dr. Horn, you touched on this too, low stress handling, the worst feeling is when that owner comes in and, they have like the cowering dog and they're like, oh, they hate it here. They don't like you. They're scared of you. And it just, you don't want to go to work in the morning. It's not fun. And as far as time goes, sure, in some cases, if we're adding on sedation, I suppose, we could see more time added. But I'm also picturing just some of the mental fatigue that comes with those nail trims, or, like not wanting to take x-rays because you have a full schedule and you're like, oh, all right, how many people is this going to take? And we're going to have to, and are we even going to get diagnostic x-rays? And how are we going to explain that to the owner? Like you said, by doing it right, by effectively using procedural sedation, we can really improve things for the animal, for the staff, and just the whole flow in our day.
Well, and I hear that a lot. People say, oh, well, we need to be efficient with our time. We don't have time to sedate. But when you really look at what efficiency means, if it takes 5 people to hold an animal down to do a procedure versus 2 people, then you're going to be more efficient with your time doing it that way. And then your personnel can do multiple things because not everybody has to focus on one patient to get that procedure done. So from an efficiency standpoint, giving sedation right off the bat actually makes your team much more efficient in the long run.
Probably really empowering too, to say, I trust you to monitor this patient and do this correctly and all of this, which along those lines, let's talk about some of the technical aspects when we're talking about procedural sedation. So we're specifically talking about sedation here. What is the difference between sedation and anesthesia?
Well, to me, that's pretty easy. Sedation is they're arousable, they're handleable. Anesthesia implies that they're unconscious, that I'm probably intubating them. And so to me, procedural sedation is a dog that's malleable, he's quiet, but I can still get a response when I touch him. He's just not going to bite me, but he's there. Where anesthesia is, he's unconscious. He's completely out, he's intubated, and I can do surgery. Now, sedation, I'm not going to do surgery. I'm going to do a minor procedure. Anesthesia, I can do a full surgical procedure.
And I think sometimes there's a little bit of and there's no clear definitions, correct me if I'm wrong, Dr. Quant, but between general anesthesia, a lot of people think when you say general anesthesia, it's meaning inhalants only. Whereas if you say the term immobilization, they might think injectable anesthetics. And so they might think of drugs like ketamine that can be given IM, or propofol that can be given IV, or alfaxolone that can go IV or IM. But when those drugs, because they have the potential to induce unconsciousness, are technically anesthetics. So just because you're using them IM in combination with a sedative and an opioid, you are still putting them in a state of unconsciousness. And so procedural sedation is sedation plus or minus an opioid for analgesia. And then anesthesia, for me, is the combination of injectable drugs plus or minus inhalant.
Yeah, I mean, we can do general anesthesia on just injectables. And there are certain cases that we do preferentially on constant rate infusions. And the only gas they get is oxygen. But are they on general anesthesia? Absolutely.
Yep. And that's the difference where I see in monitoring, because if somebody is giving something like ketamine IM with a sedative and opioid, and they might say, oh, well, I give it IM, so it's not general anesthesia, but that's not true.
I always think of it, too, in terms of gag reflex and if they are able to protect their airway. Is that an accurate way of thinking about that?
Well, yeah, that's what I say. General anesthesia, to me, means you've intubated them because they don't have a gag reflex and you want to protect the airway. So certainly, if I give enough of an injectable, I can intubate off an IM injectable, but that's still general anesthesia because I just intubated that dog. Procedural sedation is that dog still has a gag reflex. He can protect his airway. He can swallow. He's just in a better state to handle, but he's not unconscious.
Sure. That makes a lot of sense. And I'm thinking, Darcy mentioned monitoring. What should we be thinking about when we are doing procedural sedation? Because you're right, it's easy to kind of fall into that mindset of like, oh, it's just sedation and we'll just, watch them and make sure they're breathing. And in some cases, depending on what you're using, that may be appropriate. But what sort of monitoring should we be thinking about when we're performing procedural sedation?
Yeah, great point. So I personally, and I think you guys share that with me, is that anytime you give a drug that alters consciousness in any way, so be it sedation or immobilization or general anesthesia, you should have as much monitoring on your patient as possible. And so definitely heart rate, respiratory rate, those can be things that are taken manually, but there are so many monitors out there that are small and compact and can be transportable around the clinic. So it's pretty easy to also monitor pulse oximetry. If you have a monitor with an ECG, you should hook that up. Temperature monitoring is hugely important as well. Anytime you give a drug that's going to alter consciousness, thermal regulation is impaired. So having a heat source while they are under that sedation is important. And then if the pulse oximeter is not reading like it should, we need to be thinking about supplemental oxygen with a face mask as well. That's something easily to, pull over and just put a little face mask on and use the flow meter to have them have some oxygen during the procedure as well. So in my opinion, as much monitoring as you can get on that pet with sedation, the better.
I mean, there's a lot of cute little handheld monitors that you can slap a blood pressure cuff on, oscillometric. You get a blood pressure, you get a heart rate, and then you just have a little clip on the tongue for pulse oximetry. It's not hard to do. It doesn't take long. And I think there's no reason not to do that. And I know the argument is, well, see, if they're awake, I don't have to monitor them. Well, that may be true, but at the same time, when they're asleep, it's easier to monitor, right? I can slap that little blood pressure cuff on, and yeah, they're breathing, but that doesn't mean they're not hypoxemic if I'm not checking for that. And if we don't check, we could miss things, right? I'm an anesthesiologist. Why wouldn't you monitor?
Yeah.
Right?
And I think just as important as actually monitoring is having record of that monitoring, because just because you're under procedural sedation doesn't mean that something can't go wrong. And so from a legal standpoint, you want to have yourself protected and have some data to show that you were watching that patient and you were aware of what the vital signs were and that you intervened when something was telling you that it was not good at that moment.
Yeah, and I think nowadays there are the portable wireless monitors that literally will keep track of everything for you. It can go in the medical record. I mean, you don't have to sit there and chart by hand anymore. You can be watching the patient, and you can be assisting and watching the monitors. And so you have, as a doctor, someone is going to be with this pet with you. It's not going to be just you doing a majority of the procedures that require, like a small lac repair or, things that the doctor needs to be present for. So you already have the person, and you might as well just to hook up the monitors at the same time.
Yeah, I have to echo that. I'm a house call veterinarian, and I absolutely have capability of monitoring ECG and pulse ox and temperature and blood pressure, even on a house call basis. So I agree, like really tiny, easy to use, portable, cordless monitors that you can just kind of carry around with you. So Dr. Crocker, I'm curious, kind of thinking along the lines of my own practice as a house call practice, but you own a private practice. How do you fit procedural sedation kind of into your workflow throughout the day?
We use it several times a day, and sometimes it's expected. So, large limping dog that we said, okay, we should take x-rays. Owners elected to try, medical conservative treatment. Dog's not improving. You're coming in for x-rays, and it's a drop-off appointment. So we plan for that. We know what we're going to do. And then there's the appointments that they come in for something and the pet is difficult to handle, is aggressive, needs multiple things done that we know are going to be stressful and take a lot of people. So we end up having to sedate for that. And I think the fact that we've used it so much, we're comfortable with it, and my team really likes it, helps, because I don't even have to say we should probably sedate this dog. They're coming to me and saying, hey, this dog has that look. If we're going to do A, B, and C, we need to consider just sedating them. And I think as a practice owner and from the business side of things, it is better to do things the right way. I don't want to be taking x-rays and having to call owners and say they weren't diagnostic. And a lot of people worry about adding on the cost of sedation. But when you explain that it is going to be more fear-free, it is going to get you better results in the long run, I don't get the pushback that people worry about. And I think it's also having the confidence to explain it and know that it's valuable, and you get pet owners believing in that and trusting you with it. So we use it multiple times a day. Sometimes we can't plan ahead. They're on the chill protocol potentially, like GABA and Traz, and we still use it on top of that, and they do really, really well.
And I'm glad that you brought that up, because I did want to talk about using Zen Alpha kind of synergistically with other drugs. So you said you bring patients in on the chill protocol and still use Zen Alpha on top of that, and they do really well. Dr. Quant, you mentioned using an opioid. How do we think about Zen Alpha in terms of using it with other, sedatives or anxiolytics, different drugs that we would use in clinic?
Well, I think, like she said, if they've already come in on something, but it's not enough, you add another drug to it. And I think like Zen Alpha, we know has a limited time frame, so that's helpful. It's not going to last for days. I also think that if they're going to be painful, that's when I add an opioid. So I have a dog that I'm going to take radiographs. I know he has osteoarthritis, but I have to stretch his legs to get hip rads. I'm going to probably add some butorphanol to that, maybe hydromorphone, just to get some extra analgesia. We know that the alpha-2s have some analgesic, but it doesn't have the duration or maybe the pronounced effect that we see with the opioids. So to me, that just makes that dog more comfortable, and I'm going to get better results. Or if I have a dog that has a little skin laceration, I know Dr. Crocker said little lidocaine, local plus maybe an opioid, again, just for that duration, because I know the Zen Alpha is going to wear off, right? 35, 40 minutes, and my opioid is going to be there to help with the analgesic.
And are you seeing any changes on the monitoring when using it synergistically?
Sometimes, depending on which opioid you use. Now, if you use methadone with an alpha-2, you might see a little bit more bradycardia than you would say if you used it with just trazodone or gabapentin or with butorphanol. So yeah, sometimes you'll see a little bit more pronounced bradycardia with a pure mu opioid agonist.
And I do think it's good. You really explain well the two drugs and kind of how they work differently that are in Zen Alpha. So I don't know if you maybe want to go over that.
Well, but I think everybody really, Zen Alpha is not a new drug.
Right.
In the sense of before we had dexmedetomidine, it was medetomidine, right? And then what is dexmed? Well, medetomidine is the levorotary and the dextrorotary form of the drug. The most potent part of that is dexmed. So you pull dexmed out, now you've got dexmed. Medetomidine just has both drugs. So if I'm thinking about using dexmed at 5 micrograms per kilo, and now I want to make a transition to medetomidine, i.e. Zen Alpha, I would use twice the dose. So if I used 5 of dexmed, I'm going to use 10 of the medetomidine because it's not as potent. The new thing with Zen Alpha is it has a peripheral antagonist, which is the vatanoxan. So I still get the sedation from the medetomidine, but the vatanoxan knocks out that peripheral vasoconstrictive effect, so we don't see that reflex bradycardia. The beauty of that is maybe I get quicker onset time because I don't have that vasoconstriction. I don't see that decrease in heart rate, but I still see that sedation. And they wake up in about 35 to 40 minutes, and I don't necessarily have to reverse them with atipamezole. So to me, that's what makes this drug user-friendly. And it's not like I've never used it. Yeah, you used it a lot before Dexmed came out. You just hadn't used the vatanoxan. That was the new thing.
And that's also why the dose is much higher than dexmedetomidine, which I think is important because the feedback we get or I hear is it doesn't work, but people are trying to dose it less, like dexmedetomidine, and you really need to do that higher volume dose, the labeled dose, to kind of get the effect that you really want and are looking for.
And is that the case too if we're using it with an opioid, still go to that label dose?
Yeah.
I think so. To get your best effect, yes. It's not as potent as Dexmed, and that's the one thing you have to take into mind. So if I'm used to using this dose in Dexmed, I have to give more. And that's why that label dose is higher, because it's not as potent as drug.
Yeah. I think another benefit of adding a drug like an opioid to the Zen Alpha is that it does increase the duration of action. So, in where I work in a university setting, having that added duration of action is a benefit to us. So unless it's going to be a procedure where we can do in 5 minutes, we pretty much always add an opioid with the Zen Alpha just to help extend that duration from a teaching standpoint.
What kind of duration, I guess, can we expect with Zen Alpha alone versus if we're using it with an opioid?
I typically see about 30 to 40 minutes with just Zen Alpha by itself. And then if I add just a low dosage of butorphanol with a full dose of Zen Alpha, I can extend the duration out to about 45 minutes to an hour. So it's not a great addition, but it definitely adds a little bit more time to just,
I feel like that's like a perfect addition.
Yeah.
Where it's like it extends it out to, maybe an hour, but not 4 hours.
Exactly. It's still shorter duration than what dexmedetomidine would be by itself. And that's kind of a benefit to it. If you're going to be taking something like radiographs that take 15 minutes, and then that animal is up and ready to go by 30 minutes, you don't have to think about reversing, which is just going to save the owner some money because atipamezole is not cheap. So if you can use a drug to do what you need to do for that patient, and then as it wears off, and like Dr. Crocker, you had said, like they literally are sedate, a lot of are recumbent, and then they're not.
Yeah.
So there's very little hangover, and they're ready to walk out the door with the owner that much sooner without the added costs of having to reverse with atipamezole.
I'm glad you said that because that was going to be my question as far as like explaining to the owner kind of what to expect with their pet. And I guess explaining to staff too of what we expect when we use an alpha to sedate.
I think it's similar for me to other IM sedatives, right? So you give it, works within 5 to 15 minutes most of the time. Sometimes if it is a really anxious pet, we're actually going to give it with the owner in the room and let them kind of chill with them until they get sleepy. So, you're going to tell them they start to get a little loopy and then eventually like lay down, not be able to lift their head up. That's when we'll, take them from you. And then sometimes I'll watch them and it is crazy how they just pop up all of a sudden and they are ready to go. And we joke in our practice 38 minutes. 38 minutes is like what we kind of expect. Once they go down, that's how long we have. So my team has like everything ready to go. And they're like, Doc, we got to get this done. You got your 38 minutes. But it is nice how predictable it is because there's other things you do and you're like, okay, takes a while to take effect. Okay, they're still sleeping. And it can be harder to plan in that case. And because we're running on such a tight schedule in GP, I need it to be more predictable overall.
Yeah, I do kind of love that idea of the predictability because I feel that way about alpha 2s in general, like where they do kind of just, they're like, okay, I'm awake now. But, it could be in 30 minutes and it could be in 2 hours. So having that time frame of predictability sounds like a huge benefit. Can we talk about GI effects? I know that's one concern that people have.
Our dogs are coming in fasted because I know they're planned for. And the biggest GI effect is it makes dogs poop a lot. And if you have a dog that just came in not prepared, they weren't fasted. And we know alpha 2s increase colonic activity before they inhibit it. So initially you have an increase in proximal colon activity. So if there's poop there, it's coming out, okay? And then it'll inhibit that. And the antagonist also will increase colonic activity. It's a transient thing. It's not clinically significant. It empties them if they have, fecal matter there. So you just have to be aware of that. Yeah, this dog's going to poop unless he's been fasted.
Yeah. Number one question I get, and number one reason people say my team hates it, is because of the poop. And so I don't think it's something like, we kind of joke about it a little bit, but it's a big deal because you think about, you put these dogs in a kennel, they poop and they roll around in it. And then you have to spend all this time trying to clean them up. The owner's not happy that they're, smelling like poop when they go home. And so when we realized it was a side effect that was likely going to happen if we didn't know that the pet was going to be sedated. If we know, then we usually will tell people fast them that morning. We walk them when they get there. We walk them right after we give the injection IM. So we kind of help with emptying them as much as we can. But if we know this is probably going to happen, then what we do is we recover them outside the kennels. We put a potty pad under their booties, and then they sit up where they poop, and then they sit up, and then we just kind of remove it and we put them in the kennels. And that has helped dramatically with a known side effect, but not having to have the team have to clean and do all these other things. So I think if you know about it, you can just, in your workflow, plan for it a little bit better. But the first couple times when we had pets like covered in poop in their kennels, my team was looking at me like, this is the worst one ever. And I'm like, I'm so sorry. But now, again, they're the ones that say, we need to grab a Zen Alpha. This dog needs it. And they're pushing me to use it, which I think is what you want ultimately.
Sure. And it also feels a little bit reassuring where, if I'm hearing you correctly, where this isn't something that's going to like continue for the rest of the day. Like they're going to have a big bowel movement and then we're all going to move on with our lives.
Yes.
Yeah, it's clinically insignificant unless you're the one cleaning it up, I suppose.
Yes.
Then it's significant. But yeah, it's a one-time cleansing and we're good.
Yeah.
They probably feel a lot better going home.
I was going to say.
I'm curious, we've kind of touched on radiographs. We've touched on nail trims a little bit. What are just examples of procedures where maybe we're not using procedural sedation and we really should be thinking about it?
Well, for us at the university, we have a 132 slice CT. So we could do CTs on just procedural sedation. Abdominal CTs, thoracic CTs, orthopedic CTs. And so that's a huge thing because then I don't have to get involved from a general anesthesia point of view. Most dogs need some sedation for ultrasound or echoes because they're not going to lay there. And again, they don't need general anesthesia. They probably just need some sedation and an oxygen mask, a little monitor, and they can get a lot of things, diagnostic things done under procedural sedation. I think we always think, well, what can we do, like bandage changes, et cetera? But we can also do diagnostics, not just radiographs.
Yeah, absolutely.
CTs, echoes, ultrasounds can also be done under procedural sedation.
Yeah, we've really instituted it into our community practice. So, things that they would do in the exam room with or without the owner, nail trims, ear exams, bandage changes, things like that. And then where we have also instituted it is pre-euthanasia. So we can use Zen Alpha as an injection and allow the animal to get calm. And then because it does not cause the peripheral vasoconstriction, catheter placement is rather easy. So you can sedate them, get the catheter in, and then allow the pet to be with the owner until they're ready. And it's just improved the overall experience for that pet, not having to have an injection that's got something in it that stings like ketamine. So It's really just kind of helped take away all of that initial concern about stressing the pet out, especially in front of the owner.
Yeah,
being able to do that.
We try really hard to keep the owners and pets together from the second they get there for euthanasia appointment. So for us, especially with the team having to place a catheter, in front of owners, and that can be a little stressful, then if it is an anxious pet, and some of them are barely moving, right? But if they're anxious or they're worked up or they're painful, I've found giving some Zen Alpha and giving them time to relax and then placing the catheter makes the whole process much more peaceful and better for the pet and the owner overall. And then the other thing I'll use it for a lot is small biopsies or lac repairs where I can use lidocaine and I can do that for kind of just a local block, but it's something small that's going to work quickly and, again, is predictable, where I can tell the owner, leave me this, I will do this, and then come pick them up, and they're ready to walk out the door in an hour.
That one absolutely makes sense to me. My mind is still a little bit blown about the euthanasia discussion, because that's something I 100% struggle with in practice. Is sometimes I feel like to get the level of sedation I need predictably, I have to reach for drugs like ketamine, where they're going to sting, even Tilazol, a little bit. And, or, I have to reach for some of those higher doses in cases, which, especially if we're talking alpha 2s, can really make you hope your skills at alternate route euthanasias are up to snuff. So yes, the idea of something that you can give that will predictably sedate that patient to a good level and not cause that vasoconstriction, I'm like, all my wheels are spinning now.
Yeah, and it's because of the quick onset time too. You're not, taking, like, if you do want to take the pet away, sedate them, bring them back, they're going to be sedate in minutes, like 3 to 5 minutes rather than 15 to 20.
Yes, that's such a hard wait with owners. If you have like that unpredictability of like, are we 5 minutes?
Yeah.
Like, do I sit with you or do I come back? And I feel like, wow.
Yeah, so you can like sedate, get the catheter placed, and then take the animal back and then proceed. So
that was I had not thought about that. Yeah, that one really got my wheels turning.
Yeah. Especially with home services, like the fact that you go into people's homes, it's nice to have these other options.
Absolutely. And not have to repeat injections and things like that, because, most owners are very gracious about that, but you don't want to do that if you don't have to. So we've talked about duration of action and how that can be a real benefit. Of course, we're talking about like biopsies and lac repairs and things like that, especially biopsies. I feel like sometimes those you get in and you're like, okay, this is what I have to do. And then it ends up like bleeding more than you thought, or it's bigger than you thought it was going to be, or something is always not quite what you thought, how you thought it was going to go. So if we're getting into a situation where we feel like maybe we're going to run out of time, we're getting to our 38 minutes there, can we redose Zen Alpha?
Yes, you can. So they recommend to just give half the initial volume IM again, and that will continue to extend it out for like another 30 minutes. So where I've really had that come into play is if we do have like a high anxiety animal come in that, they might have come in on the pre-hospital pharmaceuticals, we sedated them, but they're still a little bit reactive, or the procedure is just taking longer. Then we can easily redose with half the volume of Zen Alpha just to extend that out a little bit more, so as soon as they start showing signs of, a patient that's lateral and tries to sit sternal, that's the point where we would just give another half dose of Zen Alpha and then give them a couple minutes for it to take effect, and then continue on and proceed with whatever procedure or diagnostic was being done.
And when you're talking about give them a few minutes for that to take effect, that, I don't know if we've talked about this yet, IV versus IM dosing, is this always intramuscular?
It's labeled for IM dose, and so that would be the preferential way to give it. The drug is meant for procedural sedation, which in my mind means you're usually giving it IM.
Yeah.
Right? And so if we use it the way it's meant to be used, it works really well.
Yep. That's amazing concept.
I know. How about that? But you're right. Like, and I almost think like it's sort of a relief to hear that, though, because especially when we're talking about sedation drugs, there's always that like, how anxious is the dog, and what dose do I use, and all that. So, if we can take like one more decision out of our day and say like, just look at the label and use the label dose. Yeah. I do want to talk about, because I know the answer to this, and I feel like other people may want this information about Zen Alpha in cats, that I feel like might be an important point to touch on.
Well, we have to look at the literature, that the research that DECRA did with Zen Alpha. Could you use it in cats? Well, sure. The question is, should you use it in cats? The answer is no, because it can cause profound hypotension. And anecdotally, I've had people say, well, I use it in cats, it works well. And my question always is, well, what was their blood pressure? Well, I don't know, I didn't check. So to me, that's kind of a disservice to that cat, because if you're not monitoring it, you don't know what effect you're getting. And the research that DECRA did shows that it's not safe at that combination. Yes, we know we can use alpha-2s in cats, for sure. But in this combination that they made up, hypotension can occur. And I have found that hypotension may be harder to treat with this than it would be, say, with just Dexmed. So to me, I don't feel like it's safe to use in cats, especially if you're not monitoring them.
And it's the ratio to medetomidine to vatanoxin. So Zen Alpha is a 1:20 ratio. So something about that higher ratio of vatanoxin that is promoting the hypotension in cats. So, who knows, like in the future, if we had a product that had a lower ratio of medetomidine to vatanoxin, perhaps that could be used in cats, but we're not there yet. At this point in time, it's just, why would you want to give a drug that then you're like, oh, now I have to deal with hypotension and, oh, it's not going to respond to the standard normal things that I can do or that I have available in my practice. And now I'm in a situation where I don't have what I need to treat that cat. It's just asking for disaster. So
yeah, cats need all the blood pressure they can get when their kidneys are functional. Like, let's keep the blood flowing through the kidneys.
Yeah.
Also, reversal, we've talked about a little bit. So if we do have one of those unique cases where, maybe it's lasting a little bit longer than we expected, or we get a little bit more profound sedation, what should we think about in terms of reversal?
I mean, technically they should come off of it with vatanoxin by itself. Could you reverse Zen Alpha with atipamezole? Yes. You can. You can give atipamezole IM, just like you would with a Dexmed dog, and get complete reversal. I personally haven't had to use atipamezole when I've used Zen Alpha by itself because they wake up in the appropriate time and it's just not necessary. But you could. You could definitely use atipamezole and it will reverse the medetomidine effect.
The volume of atipamezole would be half the volume of Zen Alpha.
Okay, I'm glad you said that because I was like, I matched the volumes. I don't even know.
It's not the same as a 1-to-1 like you would with dexmedetomidine. So whatever the volume was for Zen Alpha, you use half that volume IM. But same as Dr. Kwon.
Yeah, because we know that the medetomidine is not as potent, and atipamezole is meant to go with Dexmed.
Right.
And so if we had to use twice the dose to make it easy, then we can reverse with half the dose.
Sure.
That makes sense.
That makes sense. And Dr. Carger, from like a private practice, business ownership standpoint, I would imagine that's a big benefit of not generally having to use atipamezole.
Yeah, it is. And we talk about the fact that, Zen Alpha is not replacing dexmedetomidine. And I think cost-wise, it can be a little more sometimes. But with dexmedetomidine, I always had to reverse a lot of times. And the cost of those two drugs together actually is more than the one Zen Alpha. And I've been using Zen Alpha for almost 2 years now. And I can't think of a case where I've had to reverse. So I do think that from a business side of things and a cost and inventory side of things, having both on the shelf makes sense. And I don't usually have to use reversal.
Well, this has been such a helpful discussion. Thank you to all three of you for joining me. I think this is full of great information. I know I've learned a lot. I've got a lot of good ideas. Any final thoughts you want to share?
I think that once you start using Zen Alpha, you'll find other places you can use it. And don't be afraid to use it. Just pick the right patient. And I think you'll really come to like it.
And I would say, like, if you're scared of the effects of alpha-2 agonists, I really just encourage you to seek out some more education, because just talking to a specialist, call on an anesthesiologist, call on a VTS and anesthesia and analgesia. And, we can talk on the phone. We can have a video conference. We can potentially do some in-person training. But the benefits to the patients and the staff ability to love the product is so much more beneficial than not even considering it. So all you need is a little bit of education to help you get comfortable with it, and you'll find that it's something that how did you live without it for so long type of thing.
Yeah, I think as a practice owner, I really encourage doctors and practice owners to not just think, well, we don't need this. I think I would have a discussion with the team of, should we be utilizing sedation more, and talk to the people that are doing these procedures a lot of times. And are they struggling, and can they see it as part of the workflow? And maybe do we just try it? Like, I encourage people to just say, let's get it in here and let's try it. And once we had it, we were like, yes, we need this. And so it's a conversation with the team. It's a little bit of a culture shift, but don't be scared to try it, make a change. And I think you will see the benefit really, really quickly.
Absolutely. I mean, you've convinced me here in this conversation. So thank you again to all of you for joining me this morning. Thanks.
Thank you.
Thank you.
Thank you again to everyone for joining us. I learned a lot from this conversation. What a great group we had for this talk. A big thank you to DECRA for making this episode possible. And of course, thanks to all of you for joining us and for tuning in. If you enjoyed this episode, please leave us a 5-star review wherever you get your podcast to help other veterinary professionals like you find this and other great content we try to put out there. If you would like to hear more episodes, you can click on the education tab on the VetFolio website or find us wherever you get your podcasts. We're always eager to hear your thoughts and ideas for future episodes. Please feel free to email me at dvm@vetfolio.com. We can connect on Facebook at Dr. Cassie DVM, or you can follow me on Instagram at dr.cassie.dvm. And remember, if one animal is better off because of you today, it's a great day. Important safety information. As with all drugs, side effects may occur. For use in dogs only, not intended for use in cats, not for use in humans. Avoid skin, eye, or mucosal contact. In case of accidental oral intake or self-injection, seek medical advice immediately and show the package insert to the physician. Do not drive, as sedation, loss of consciousness, and changes in blood pressure may occur. People with cardiovascular disease and pregnant women should exercise special caution to avoid exposure. Uterine contractions and decreased fetal blood pressure may occur after accidental systemic exposure. As with all alpha-2 adrenoceptor agonists, the onset of sedation may be delayed or may be inadequate in some dogs. The analgesic effect of Zen alpha will not last longer than the sedative effects. Additional analgesics should be administered as needed. Do not use Zen alpha in dogs with cardiac disease, respiratory disorders, shock, severe debilitation that have hypoglycemia or are at risk for developing hypoglycemia, or are stressed due to extreme heat, cold, or fatigue. Zen alpha should not be administered in the presence of pre-existing hypotension, hypoxia, or bradycardia. Due to the pronounced cardiovascular effects of alpha-2 adrenoceptor agonists, only clinically healthy dogs, American Society of Anesthesiologists, ASA Classes 1 and 2, should be administered Zen alpha. Dogs should be monitored frequently during sedation for changes in heart rate, blood pressure, respiratory rate, and body temperature. Tachycardia may occur in some dogs after recovery from sedation. The following adverse reactions have been reported: diarrhea, muscle tremors, and colitis. Refer to the prescribing information for complete details or visit www.decra-us.com. That's www.decra-us.com.